Hi, I'm Michael Gelb. I'm a dentist, and I founded Airway Centric with Hindin and Jeff Hindin and John Kelly, and we're at Jason Kim Dental Labs.
Today we have the Airway Centric Dentistry Level 1 course for dentists and their staff.
How the airway relates to what dentists, physicians, the public may want to know about overall health and wellness that's related to the mouth and the jaws.
Basically, disseminating information is the biggest part of it, and teaching people about things that they don't know. Every dentist who's here today is phenomenal at what they do, but we're adding something to them that's going to help them do their dentistry better.
We're saying that dentists need to look at the airway first. Everything that happens either changes the airway for good or for bad, and dentists need to know about that.
Most people know what snoring is. Not everyone knows what hypopnea is or sleep apnea is. So 90% of obstruction of the airway occurs behind the upper jaw and the lower jaw. And that's why we're here today speaking with dentists specifically, because dentists have a big role in unobstructing or opening the airway.
The main thing is that what causes these sleep problems? Is there something that we can do dentally to help these patients who have sleep problems? And are there other issues that they have? They may not have sleep issues, but other things that are related to airway as well.
Because dentists, we repair teeth, we fix teeth, and we look at models of teeth, and we sometimes forget that these teeth are connected to the rest of the body and have an influence on the rest of the body.
They don't realize the amount of control they have. So 50% of the patients in a mature dental practice in the chair, coming in for cleanings, coming in every day, have airway issues, have sleep issues, have breathing issues. So the dentist is one of the key focal points, because they see the dentist and the hygienist usually twice a year, sometimes 4 times a year. They probably have more contact with their hygienist and their dentist than they do with their physician.
So a hygienist has 45 minutes to an hour to ask the right questions.
So dentists are starting to diagnose sleep apnea or these sleep and airway problems.
Well, our goal in this course is to change the thinking of the dentist, change the paradigm. We want the dentist to think. We want them to think about, are we helping the patient? Are we changing the airway or not?
We recently started a foundation for airway health, which is dedicated to the awareness of the problem. That's one group, the foundation. We started an academy of physiological medicine and dentistry, which is for professionals, and it's a multidisciplinary group. Jason Kim and Marcello Allegra, they're visionaries. They realize that dentists should understand about the role of the airway in the jaws and how it relates to how the jaws fit together and ultimately how the teeth come together.
As a dentist, working in the lab is a partnership, and the better partner that you have, the better that things work out for, really not even for you, for your patient. And so having somebody who's excellent and does excellent work really helps get things better. Now, if I can create a plan where I want things to go, and then Jason can follow that plan and is aware of why I'm doing those things, things work out better.
They're the masters of doing teeth. The teeth get made only after you've corrected the airway and sleep issue, gotten rid of the headaches, and then you can really do the most aesthetic, the most beautiful teeth that stabilize the airway and keep the patient healthy their whole lives.